Hello, everybody. Thank you for the patience. As you know, my name is Valeria Ferrari, and I'm glad to introduce you Dr. Antonino Cacioppo. Today is the second webinar with him. I'm really honored to be with him because he's one of the best key opinion leader that we have in Italy, and I hope you enjoy it. And the topic of today will be Titan in prosthodontics. So we will have overview from the evaluation of the provisional to the management of failure and fractures. So what we call the pain that we find in our daily practice. Dr. Antonino Cacioppo is the owner of a private practice in Palermo, the amazing Sicily, and is also professor at the University of Catania. So I don't want to lose your time because I prefer that Dr. Cacioppo will start his amazing presentation. So thank you again for being here, and please, if you have any questions, don't be afraid. You can write in the chat, and I will read them at the end of the webinar, so we don't interrupt the professor during his speech. Okay, thank you again. If you have any trouble, just write me. Thank you.
Thank you, Valeria. It's a great pleasure for me to be here, and this is, as you said, the second webinar, a worldwide webinar. And today we will talk, of course, about Titan, but about Titan in prosthodontics. This is a very hot topic to me. Okay, I love a lot the prosthodontics aspect of this device. And I want to start again, like the other webinar, talking about Titan. Okay, as you already know, the Titan is a device to have a feedback of our muscles, the two temporals and the two masseters, and all this data collected from this device is related to the contact points. Okay, and it's very important for me as a dentist. So only for probes, and as I say, 2 on the temporals and 2 on the masseters, and the collected data are very simple. This is the key for the success of this device, because we have the balance, and we can manage with a 5 seconds examination the balance between the 2 temporals, that is called POC temporals, TA, the balance between the 2 masseter muscles. Okay, this is the second one, and the barycenter, that is the balance between 2 couples, the 2 temporals that are related to the anteriors and the masseters that are related to the posteriors. And the torsion, that is very important. It's very difficult to see with our eyes or other devices the torsion tendencies of the jaws, of the lower jaw, of course, and the asymmetry, of course, and one of the most important values to me, that is the impact, that is related to the work of all the 4 muscles. And when we have low values, it's related to, it could be, okay, it could be related to higher vertical dimension. Of course, we have to see if everything is right, if we don't have the pain that blocks everything and stuff like that. And when we have high values, it could be related to a loss of vertical dimension. This is the basis to understand the Titan, and we already know all these aspects in the last webinar. So we have to imagine all these 4 muscles on the occlusal image of our lower jaw. For example, it's the same occlusal plane. They are the same. They are one the opposite of the other. Okay, with of course with our bite check or contact paper. I use a lot the digital contact paper. I prefer, and we have to start thinking that there is a new way to evaluate the contact points. Okay, it's not only visual, it's not only related to colors, it's not only related to papers or virtual papers, but it's related also, this is absolutely a new concept. To me, it was a revolution, but it's also related to muscles, and all the feedback that I can have from muscle, of course, by means of Titan. Because, for example, all you already know everything about how to examine two arches like this, okay, and the diastema, okay, there is a missing tooth, the 3.6, there is a prevalence of red color, so there are pre-contacts on the right, and there are also contacts on the anteriors. But are you pretty sure that you have understood everything from this kind of examination? Absolutely, of course. We miss X-rays, we miss a lot of examination, the clinical examination, a lot of things. But what about the contact points? Okay, this is the trick. This is the key, and this is the aspect of these contact points by means of the Titan, and it's the same, but it's also more. Okay, it's a different approach because you have numbers and you can read by yourself, and also of course with colleagues and also with the patient, and you have a prevalence of the masseter of the right, okay, a prevalence of the temporals of the left, the barycenter is on the anteriors, and there is a tendency of torsion on the left, and the impact is higher than normal, and this could be related to a loss of vertical dimension. This is a new way to look at our patient's mouth. Okay, there is nothing new in dentistry, but it's a new way to look at the same thing. Okay, but of course in prosthodontics, could it be useful? Absolutely yes, but in what situations? Okay, we start to evaluate all these situations and clinical situation, clinical scenario, and we will have for clinical cases, and of course only to be an example of applications. It could be useful, the Titan, in prosthodontics when we have to manage vertical dimension. Of course, we saw this kind of approach in the last webinar. And when we want to test one or two or more provisionals, okay, the provisionals are very, very, very important to me as a prosthodontist, because maybe the 90% of my job is managing the provisionals, okay, and maybe also yours. And I want to analyze, and I want to change, I want to manage the contact points of the provisional, and of course to copy all these changes on the final restoration. Okay, and of course I use a lot, as I said, the digital mean to transfer all the information, but you can also use the analogic way. It's absolutely the same, and it's very important to use the Titan, and we will see during this webinar, during the registration of the bite blocks. Okay, you have to think about the great rehabs, full arches with no teeth at all. Okay, it's very useful to have some feedbacks from the muscles, and not only aesthetics and not only parameters from the literature and so on. During the test of walks-ups, the try-in and so on, and during the test of the ceramics, the raw structure of the ceramics before glazing, and if you want, of course, also after glazing, but I prefer to have a check before glazing. In this way, it's more clean, okay? And of course, to avoid, if possible, of course, and to have a lower risk of fractures. In prosthodontics, it's not so easy to manage the fractures, okay? Of course, we can answer 100% of the time using zirconia, but it's not a good option, okay? Not in 100% of cases, and we need to understand the causes of the fractures to avoid this risk. This is my approach, of course. I want to examine with you four cases, okay? They are absolutely an example of what you can do in prosthodontics by means of this approach, Titan-guided approach, Titan-based dentistry, like I said. This is a case of two arches, okay, full rehab. It's not nothing new, okay. It's not the case, and I have, and also at that time I've got 100% of guided surgery in during my life as a practitioner, and I did prefer to have guided surgery on the upper jaw and the lower jaw at the same time. This was my approach. Okay, no teeth at all. I started from the total rehabs, okay, that are here. And when I started this case, and this is for the first two cases I present to you, when I started this case, I didn't have Titan. It didn't exist. So I started as usually, okay, 3D X-ray, walks-ups, and all the parameters with my technician. We choose the best parameters and the best aesthetics, the symmetry of the face of the patient, and the lip support, and so on. And after that, my surgery. Okay, at that time I preferred a lot the flapless approach. Nowadays I prefer the flap approach, but I have 100% of guided surgical approach. By the way, in just one visit, this is the situation. All the implant positioned, everything was good, and after osteointegration, the analogical impression, okay, because this is a very old case. I don't work at all nowadays in analogical world. I'm full digital, 100% full digital. But this is maybe 10 years ago, okay. And I realized two structures, two full arches, Toronto bridges, one with ceramics, metal ceramics, okay, no zirconia, and one on the upper jaw and one on the lower jaw. And everything, the photography is not so good, but because of the position of the jaw, but everything was pretty good, okay. The contact points were pretty good, the aesthetics pretty good, the patient was very happy, but after that point, and this is not usually to talk between colleagues about this kind of situation, but it's true, because after the end of this work, I started with fractures of ceramics, and a lot of times in the same point, in the area of 2.3, okay. This was very strange to me. I didn't understand, okay. I changed the ceramic and then that point, and I changed the contact points in protrusion and in lateral movements. We didn't understand with my technician. Everything looked pretty good, but there was something we didn't care. Okay, and at a certain point, 5 years ago, I started working, or maybe 4.5 years ago, I started working with Titan. Okay, and this was one of my first passions with Titan, because I wanted to see if maybe something related about muscles. Okay, I didn't understand, and I started this examination. Okay, this is a full screen, and you can see pretty good, I think. And this is the examination. You have we had prevalence on the left, okay, the blue point on the left on the temporals, a little prevalence on the right with masseters. The barycenter is absolutely on the anteriors. There is also a torsion tendency on the left side, and look at the impact. The impact 290. It's absolutely a high value. Okay, it was not the normality. It was not good. I started thinking about this value, and I chose with my patient. These are all the values. They are bigger, so you can read. I chose this kind of approach. I had a bite splint, 2 millimeters, and I started to maintain this bite splint on the lower jaw, okay, and to rebalance the contact point, okay, between left and right, anterior and posterior, trying, of course, something better, okay. And this is after 90 days. Everything was perfect, and also the patience was perfect. Of course, you are thinking about, okay, you have the raising of the bite splint, maybe, okay. But I wanted a new occlusal plane. Maybe the vertical dimension was absolutely wrong. I started thinking this way, and it was true. I absolutely had a wrong choice of a vertical dimension with my technician, basing only on the aesthetics and only on parameters that are on literature, okay, and absolutely not working guided from the muscles. But I started thinking to have a new occlusal plane, okay, to obtain absolutely this kind of balance. And this is the new structure. This is one of the most important moments when we have to use the Titan. There is when you have the biscuit proof, okay, when you have the raw structure with no glaze on the ceramics, and you can have a lot of changes on the occlusal plane. And this is the first try-in of this structure. Everything was perfect, okay. We maintained all the balance of the bite splint, previous bite splint, okay. This is the new occlusion, and the results, it's not only related, of course. After that we went on glazing and we finishing, so the color matched 100% and so on. But the point is that prosthodontics is not only related to aesthetics, okay, not in 2020, okay. This is, of course, an important aspect, the aesthetics, but we don't want fractures, we don't want failures, we don't want to manage the patient, okay? And it's very funny that in the last 4 years I saw this patient two times a year, okay, for my check, and I didn't have no more fractures, okay, and it was a good result to me. Of course, the patient is very happy today. I changed the balance band and the balance with my titan. I changed the vertical dimension. I changed not only the contact points, okay, but where the contact points are, and same materials, same a good aesthetics, of course, same ceramics, but absolutely no more fractures. And this is a good starting point to me. Okay. Of course, the follow-up will follow in the future. This is the second case. Another case of surgery, another case of implant retained prosthodontics. That is the most difficult, and I'm very involved in guided surgery and implant retained prosthodontics. This is my passion, okay. But this was not easy. It's absolutely an old case. I started this case in a pre-Titan era, okay. And the very difficult thing is was that the patient, there is a female, she didn't want at all to work on the lower jaw. That to me it was crazy. She only wanted to work on the upper jaw because it was more important to her. Okay, we started our analysis. We started all the process to have the guided surgery. During one guided surgery appointment, we have all the extractions, and we manage the surgical guides. We have all the implants, all the abutments, and this was this on the left. This was the provisional. Okay, this is not perfect. It's not so amazing in aesthetics, but who cares? Okay, the patient was absolutely happy with this provisional, and we maintained the provisional for 1 year because we lost one implant on the left side, and I managed this kind of failure with 2 new implants on that side. You can look here, okay. And after a while, we were ready to finish the case. So digital impression, 1 year after the first surgery, no Titan, okay, until this point. We will see when I started Titan approach in this case, because this was a very good case. I didn't want fractures. I wanted to prevent. Okay, in the first case we saw that I managed the fractures, but in this case I wanted absolutely to prevent the fractures. Is there a way to prevent the fractures with no zirconia, with ceramics on Crobo Cobalto? Okay, 100% digital, and the gamma impression is very good. Scan abutment, only 1 appointment, and we designed the structure with my technician in the lab. We started using also a facial scanner at the time in 2015. It was one of the first try with facial scanner to me, of course. And we had 2 tries, okay, in 1 appointment. The first was an full anatomical try-in. There is this one. It was printed with resin, okay, and it's a shame that I didn't have at this point my Titan, because this is the best moment to have a Titan examination, and we will see on the next, or maybe on the last case of this webinar. Okay, but remember, you have to remember this. The moment of the try-ins before the provisional, or if you want, after the provisionals and before the final structure, the try-ins moment is absolutely the perfect moment to use your Titan and to rebalance, to manage the contact points. Okay, and we have a aesthetics examination, aesthetics check, and of course X-rays to have a check of the couple of the implants and the structure, everything on laser melting. Everything looks pretty good. The final ceramics, okay, wow, my technician was very good. The first try in, everything was pretty good to me. Okay, it was a good case. Okay, good aesthetics. The lip was good. The patient was very happy. It's a shame not to work on the lower jaw, but okay, this is life. We cannot have 100% of what we want. And the question, and okay, I finished this case in 260 on the October, 4th of October. And are you pretty sure this is a good case? Okay, this is not a Congress. This is not a Congress when I finish with this image. Okay, this is a webinar, and I want to trust you. I want to be absolutely 100% sincere with you. Okay, so the truth is that at this point I started working with my Titan. Okay, exactly at this point. It's not the right point, but it's the right time. But I didn't have before. And what about the contact points? I didn't want failures and fractures, because it was absolutely a good case from the aesthetics, aesthetic point of view. Okay, and this is the result of the first Titan examination with the final structure on the upper jaw. And look at this, the impact is very, very, very low. Okay, it's absolutely a good thing, a good news, because when you have low values of impact, you can manage the vertical dimension with a lot of easy way, because you can decrease the vertical dimension. Okay, you can take your bars and have a milling, maybe on the lower jaw in this particular case. And we have also an unbalance in the posteriors, the masseters, in the anteriors, and the barycenters is all on the anteriors, and there is also a little torsion on the right side. Okay, nothing that I can't manage with my Titan. Okay, there's no way to manage this kind of things only with contact paper, no way at all. And okay, this is, to me, this is the right approach. So I started working on this point with my bars. Okay, look, okay, this is the previous slides. Okay, look at this, look at the arrow. Okay, look at the point, the blue point. This is where I want to start working with my bars on the intraoral side. Okay, I started working on that area. There is a lower cuspid on the right. Okay, and all the values became better, but they were not absolutely perfect. So another adjustment on this side, and everything was unbalanced on the other side. Okay, everything changed. This is the truth. Okay, it's not only a case for congresses. This is absolutely the truth. So I started thinking about this imbalance on the masseter side on the left, and the POC on the temporals is also on the left. The barycenter is on the anteriors. The torsion is on the contrary. Okay, we started, look at the previous again. We started with the torsion on the right side of the patient, and now we have to manage a torsion on the left side. There is absolutely okay, because we have the space, because impact is absolutely higher than before, but it's not 100%. It's lower than 100%. So I can increase, okay, and a little adjustment, and the impact increases and increases and increases, and everything looks absolutely good. Okay, this is the way to start the follow-up. And this is after 3 months. This is after 1 year. Okay, a little unbalance on the left side, but look at that lower jaw. It's absolutely crazy, but that's life. Okay, it's not a perfect case, but on the upper jaw, in the last 4 years, we didn't have any fractures. And this is the same kind of ceramic that I used since 10 years now. Okay, and previous than Titan, I had a lot of fractures, and I didn't understand why. And to me, the answer, it was not the use in 100% of cases of zirconia. Zirconia, it's very beautiful, but to me, it's too hard on implants. This is my approach. Okay, so this is Titan guided and full guided, full digital guided surgery and rehabs on implants. Okay, 4 years and no fractures at all. This is a good result to me. But this is a case, this is one of the 2 last cases of this webinar. This one, I started this case in my Titan era. Okay, I started with Titan, and it's not finished at all now. I'm finishing in these days. Okay, but look at that. Okay, this is the first visit. We had our digital impressions. Look, okay, on the upper and right side, no teeth at all. Of course, everything in this moment is absolutely unbalanced. Okay, you can imagine that. We started this case with lab side virtual workshop. Okay, these are a few images from my technician. He works on Exocad, and this is a workshop printed. Okay, this is a try-in printed with a resin, standard resin. There is also X-ray resin. Okay, you can use it like a X-ray guide and X-ray stand. Okay, this is the try-in of this workshop, and these are the real contact points with my contact paper, and I scanned in color and through color the contact points with a classical paper, okay, analogical way. And this is the Titan examination. And like I said before, this is the most important time when you have to check, because if you have a wrong balance, a wrong digital dimension in this moment, at this moment, probably you will have also later. Okay, it's absolutely obvious. Or maybe you are very lucky, but I don't trust in luck. Okay, this is sorry, this is the rebalance, not perfect, but almost perfect. Okay, and after that we undergo the CBCT examination, the project, everything in digital, everything to the lab, 100% digital. And the lab side, we absolutely, with my technician, we maintain all the occlusal values that I managed in intraoral side with the train and with the Titan. Okay, the aim to me is to maintain the height, the vertical dimension, the balance, the contact points. Okay, I want to maintain, and the digital is absolutely the right way to maintain 100% of information. These are this is the how we work today. Virtual extractions before surgery, virtual abutments. These are multi-unit abutments, and virtual workshop of the provisionals. Okay, we print the provisional, of course the outer side of the provisional. On the inner side we had some metal. Okay, and this is the surgery, day of the surgery, 1 day surgery, and of course immediate loading. That is very difficult to manage, thinking about contact points, contact balancement, and the balance between left and right, anterior, posterior, and the management of this is full guided, of course, surgery, and the management of the vertical dimension. But it's not only related to aesthetics. I don't care about aesthetics in these cases. In these steps, of course, at the end of the process, I want a better gum, I want a better aesthetics, and I want to finish for my congresses. Why not? But this is the day of the surgery, and this is the Titan during the day of the surgery, at the end of the day. Okay, it's not easy, but I maintain all the parameters I had before in my try-in, and also a lower impact. Okay, this is because it was a long day, and the patient is in absolutely, it was not so good. And okay, but I started managing the provisionals with clinical checks, with managing, of course, the gums, and I had my X-rays to see if I had bone loss. Okay, 3D examination. 9 months after the surgery, and after managing for 9 months the provisional, 100% guided by Titan, this is the aspect of my balance. Okay, it's not related to aesthetics, because this is a bad provisional. I don't care at all. I want pretty amazing gums at this point. Okay, I don't care absolutely about aesthetics of the provisional at this time. Of course, later I started to, I will start, this is a case that I'm finishing nowadays. I will start to manage all the aesthetics, focusing on the shapes of and the color, of course, of the teeth, and so on. But look at the muscles, and these are the gums nowadays. This is absolutely one of the last photos I took. And okay, the point is that it's a very good weapon, the Titan, to manage the occlusal point and the balance and the and the vertical dimension from 0 time to the finish, or like this case, to the time where we are ready to the final restorations. Okay, and this is the last case for today. It's a very difficult case. I started this case 100% with my Titan. It's impossible to me nowadays to manage a case like this without my Titan. Absolutely impossible, because we had no vertical dimension. Okay, and we had a very difficult patient. She came. It's a woman. 72 years old woman with depression. It's not easy to manage from like a, can I say, from an emotional point of view. The daughter asked me to have everything in few appointments, okay, because she was not good. Okay, this was absolutely an amazing case, an amazing proof to me. Okay, I started with byte block registration. This was not a patient of mine. Okay, this was a patient of a colleague of mine, and she started in analogical world, and after this byte block registration, of course, Voxis, I started 100% in digital world, in my digital world. But in these cases, so you have to think about full edentulous. Okay, is it right to have only the as a parameter to manage only aesthetics and only the lip, the upper lip and lower lip, and the symmetry and the medial line, the bipupillar line, or we can have more? Absolutely, we can have more, and I want to have more, because I start this registration with the Titan. Okay, and this is how I manage this imbalance. I started with absolutely an imbalance, and I rebalance the Voxis. Okay, after that, everything in a digital world, and this is the lab side, and we have the digital workshop of the missing teeth, of course, and we printed this digital workshop, and this is the try-in. Okay, and like I said before, this is the most important time for this kind of rehabs, because we can have a lot of tries. We can change everything. We can change the tooth dimensions and shapes and the length, like okay, in this case, and symmetry, and of course the contact points, but only if we have and we can manage the Titan, because these are the values with my okay, it's bigger. These are the values with my try-in at starting, the pre and the post. Okay, just a few checks, a few bars, and everything looks amazing. Okay, from the muscles side, the muscles point of view. This is the Titan. Okay, the muscles point of view. We undergo the CBCT on the upper and lower jaw, the project, everything again to the lab. We have to manage a lot of information, but in this digital area, everything is possible for our technician. Virtual extractions, the WhatsApp is like a guide for the final restoration. These are the virtual abutments. Okay, the virtual works-up of the final restoration. These are the structures. I prefer, of course, screw-retained Toronto bridge, screw-retained implant bridges. Okay, these are modeled at the same time, and the contact points were checked before on the train with the Titan. This is amazing. Okay, of course we have to we want to prove that everything is right. Okay, this is a gypsum try-in, but the gypsum it's not related to analogical impression. Okay, these are the real models printed, and everything is ready for the surgery. It's very fast, my surgery. This is the smile of the patient after half an hour or maybe 45 minutes. Very, very, very fast, very easy. Okay, there's nothing difficult during this kind of surgeries. Full guided, everything was good, everything is okay, everything is ready before the surgery. Okay, the patient was very, very, very happy. But what about Titan? This on the right side is the Titan the day of the surgery. It's not perfect because the impact, it's not 100%, but you can imagine that it's absolutely a great change between no vertical dimension and a vertical dimension like this. It's absolutely mind-blowing. Okay, and this is after only 30 days, 1 month. Everything is perfect. The patient was good, everything was good, no pain at all. Okay, and this is my approach to these were only a few examples of my approach in prosthodontics. I hope you enjoyed